Hello, my name is Taryn. I am a registered nurse and I was the Director of Clinical Services for Independent Living for just about 9 years. I'm here with you today to talk with you about the clinical services that you may access as a Deerfield Independent Living resident. So as you may know, Deerfield has a small clinic which is located near the entrance to Haden Hall. And that clinic provides 3 different types of services. So the first is physician services, a second is nursing services, and a third, which falls under the umbrella of nursing services, is called supportive care services. Today, I will talk about all 3 of these services and hope that you leave here with a better understanding of the care that you can receive right here on campus. So I first want to say that the Deerfield Clinic was incepted, and its primary aim really is to be a nursing clinic. And all nursing services offered through the Deerfield Clinic are available to all independent living residents, regardless of who your physician is. However, as I mentioned, the clinic does offer physician services, and I'm going to talk about those now. So, not long after the clinic opened, we realized that residents had a need or a desire to have physician services conveniently located on campus. And so we contracted with MAHEC, Mountain Area Health Education Center. We provide the space, a small clinic with a space for the physician and 2 exam rooms for physician services, and MAHEC provides us with providers. Typically, we have 3 physicians and 1 nurse practitioner, and they each work 1 or 2 half days a week. So on most days, we do have a physician or a nurse practitioner available in the clinic to see residents who choose for MAHEC to be their primary care home, so to speak. So in order to access the physician services at Deerfield, a resident needs to decide that they want their primary care provider to be MAHEC. So let me give you an example. If your primary care physician is Dr. Jones with Asheville Family Practice, and you intend to stay with Dr. Jones as your primary care provider, then you will not be able to access the physician services through the Deerfield Clinic. In order to do that, you would need to give up your current primary care physician and elect a new primary care provider at Deerfield. And the reason for that is that it simply isn't safe to have more than 1 primary care provider, because a primary care provider's main objective is to ensure the continuity of your care, and that all of your medical care is sort of organized and at home and understood by 1 practice, one provider. So I do recommend MAHEC's primary care services, particularly to incoming residents who do not have an established relationship with a local provider, so those residents who may be moving from outside of the county, or also for those residents for whom getting out to see a doctor off campus poses some sort of trouble or inconvenience. The benefits to using MAHEC, I think the first is quite obvious, which is that they're here. They're right on site. It is very easy to get to the clinic to be seen. We are, in most cases, able to accommodate same-day visits for acute needs. When we are not, we generally are able to at least make the resident an appointment to be seen by a MAHEC provider at the main MAHEC campus in Biltmore, but we're very often able to accommodate acute care visits here. In significant circumstances in which there's a clinical urgency and the resident is unable to physically get to the clinic, we're often able to provide home visits. So those are great benefits to Deerfield residents who choose the MAHEC practice. Another benefit is that the MAHEC physicians have privileges at Mission Hospital. So a resident who receives their primary care through MAHEC at Deerfield, if that resident is transferred to Mission Hospital and admitted, instead of being followed by a hospitalist as an inpatient in the hospital, that resident would be followed by a MAHEC physician, which is beneficial because that physician has then direct access to your primary care provider, as well as direct access to your entire medical chart. And another benefit, of course, is that the providers who work on Deerfield's campus understand Deerfield, this unique CCRC, the levels of care, the nurses and nurse aides who work in the clinic and help to care for independent living residents. And I believe that there's a benefit to having a provider who understands this unique environment in which you've chosen to live and the services that are available for you here. Lastly, there is some benefit, some additional benefit in that the MAHEC providers typically care for residents who are admitted to skilled nursing. There is one concierge practice that will follow their patients in skilled nursing, but otherwise, because of prohibitive regulatory requirements, most patients in our skilled nursing facility receive their primary care from our MAHEC medical director. And so for continuity of care, it can be a benefit in that way as well to be a MAHEC patient. But, so I'm gonna now set physician services aside and let you know that regardless of who your primary care doctor is, whether you decide to join the MAHEC practice or you choose to seek or stay with an alternative primary care practice, nursing services at Deerfield are always available to you, and it is critical that all independent living residents understand that very important fact. So the Deerfield Clinic has 3 nurses, 1 LPN who works very closely with the physicians, and 2 RNs. The clinic has walk-in hours for nursing services Monday through Friday between 1 p.m. and 3 p.m. So that's walk-in hours Monday through Friday, 1 p.m. to 3 p.m. This is the time that the nurses set aside in anticipation of residents visiting the clinic in need of some sort of nursing assistance. So during this time, you may come simply to talk to a nurse for triage of some sort of minor concern, minor clinical issue that maybe has your interest piqued, but you don't think really warrants calling your primary care physician. So an example might be, a rash that has erupted, or you notice that you've been having headaches and you're not sure if you should call your doctor, right? Something minor that you would like to be triaged by a nurse. Also, if you have any questions about a medication, that would be a good reason to visit the walk-in clinic. Other reasons would be if you require some sort of injection and would like for a nurse to do that for you. We're able to do that with physician orders. Also with physician orders, we're able to assist with wound care. Nurses are glad to talk with you about any trouble that you may be having in the independent environment, potentially if you're interested in learning more about the different levels of care at Deerfield or therapy services. All of these would be great reasons to stop by during walk-in hours and talk to a nurse. Also, nurses, of course, per your contract, provide 24-hour response to campus medical emergencies or urgencies. So this is why you were given a pendant when you moved into Deerfield. That pendant you can press or you can pull a pull cord on a wall, and what will happen is a signal is immediately transmitted to a desk in skilled nursing that is manned 24 hours a day. So if you press that or pull a pull cord, you are summoning nursing and security assistance. The person who gets the signal at the desk is first going to call you at the number that you've listed with Deerfield's main directory. The reason that we call is to rule out false alarms. If you answer the phone and tell us you don't need us, then we will not come. If you do not answer the phone, we are going to assume that it is an emergency and we are going to come to your location, which is triangulated with decent accuracy based on your pendant and with excellent accuracy if you pull a pull cord. So what will happen if you need us is a security guard and a nurse will arrive to your location. We aim to arrive within about 5 minutes, but we say this wait time can extend to about 15. So if you're experiencing a medical emergency that is potentially life or limb threatening, and you're able to also call 911, it doesn't hurt to get first responders en route if you're certain that your medical emergency is very serious. Otherwise, know that we will be there within 15 minutes and most times sooner than that. What the nurse will do is triage your medical emergency and provide basic first aid and also recommendations and assistance with what may come next. So this may mean calling an ambulance for transport to the hospital. It may be helping to make an appointment to attend an urgent care facility, an orthopedic walk-in, or even your primary care doctor. Or it may just be walking to your medicine cabinet to grab you some Tylenol and bring you a glass of water and sit with you for a little while and make sure that your vital signs are stable, right? So we want you to follow this system if you ever need a nurse. Please use this system versus calling someone. If you call, there's always going to be a bit of a delay in the response because all of our actions are sort of coordinated around this very fine-tuned system. Know that you are welcome to press your pendant or pull your pull cord, not just for major medical emergencies. You can also use this for urgencies. If you've been up all night with gastrointestinal symptoms and you're worried that your blood pressure is low or feeling dizzy, that's a fine reason to press your pendant, even though you most likely don't need to be transported to the hospital. So know that we are available for you and we want to be there to assist you in any case in which you are feeling uncomfortable, you have clinical symptoms, and you would feel comforted by the presence and assessment of a nurse. I will now shift to supportive care services. So supportive care services are administered through the Deerfield Clinic with the oversight of a registered nurse. We currently have usually between 4 and 5 certified nursing assistants who may be essentially sort of contracted through the supportive care system to provide services to independent living residents that help them to remain at home. So let me give you an example of when you might call the clinic to request some supportive care. Let's say you have had a surgery on an upper extremity and you're finding after returning home that you're struggling with getting dressed in the morning, buttoning your upper buttons, and maybe also with showering. So these sorts of activities of daily living are things that our nursing assistants can help you with on a short-term basis as you regain your independence and your functional level after this surgery. So supportive care is meant to be for any service that requires somewhere between, about 30 minutes or maybe an hour. We generally don't provide services that require more time than that. And in fact, that's when we would recommend contacting a home care agency. Supportive care is meant to be the stopgap between no help at all and the minimum requirement for an agency, which can be about 2 hours these days. Additionally, supportive care staff can go grocery shopping for residents who are unable to shop for themselves. They oftentimes will walk dogs for someone who is sick or injured and can't walk their dog. There are a variety of things that can be done. So if you find yourself with a need, don't hesitate to call the Deerfield Clinic and find out if your need is something that can be serviced by the supportive care team. Additionally, you should know that the supportive care team makes rounds through the independent living apartments every day. So in the middle of the night, around midnight, security officers go by and flip up a little knocker that's on your door. They flip that up, and then when you wake up and open your door, that little knocker falls down. So around noon every day, the supportive care staff walks through all the hallways of the apartments to make sure your little knocker is down. If it's not, then we're going to be concerned because it's noon and you haven't yet opened your door. And so we're going to knock and just make sure that you are okay. Another service that the supportive care staff offers is that we are able to deliver a lunchtime meal from the bistro to any resident who is ill, injured, returning from a stay in skilled nursing or the hospital. We're able to offer this service for a period of 2 weeks if you need us. Another example would be if you have symptoms of infection and don't feel that it's appropriate to go to the bistro. And of course, we plead that if you believe you may be contagious with any sort of pathogen, please to avoid dining in at the bistro in order to protect the health and wellness of the community. So give us a call at the clinic. We will be glad to provide you a meal for the day. I will make sure that you have information regarding what phone number to call and when. Lastly, I want to ask all of you to please keep in touch with the clinic if you have any scheduled surgery or procedure. If you're going to the hospital, if you found yourself in a hospital unexpectedly, please let the clinic know. It's important to us to gauge what's going on in the community, where residents are, so that we can anticipate bed movement, the potential need for admission to assisted living or skilled nursing, and also so that we can provide appropriate follow-up and care to you when you return home from your procedure or surgery. Lastly, I'd like to make a quick infection control pitch, which is also please give the clinic a call and report to the nurse if you have any new symptoms that could potentially be related to a contagious illness. So this is anything that feels like a cold, feels like the flu, feels like minor allergies, or feels like a gastrointestinal upset that isn't directly linked to something that you're aware of. Just give us a call and let us know. It's very helpful for us to have a pulse on what might be going on in our community related to infection. That gives us a leg up on controlling the transmission. So thank you so much for bearing with me during this sort of rapid fire, brief review of the services offered through the Deerfield Clinic. If you have any questions at any time, you can always call the clinic and ask to speak to a nurse. We will be glad to answer your questions over the phone or to invite you to the clinic to talk with us. We understand that this is complicated, and just know that it's so critically important to us that residents know that we are here for you. The nursing services are available to you regardless of who your physician is. We want you to call us if you need us. We want you to press your pendant if you need us. And we're just so grateful that you're here at Deerfield. So thank you so much for spending some time with me today, and I look forward to seeing you in the halls. Take care.